The Nigerian healthcare system has suffered several downfalls as statistics from the World Bank shows that Nigeria accounts for 14% of all annual maternal deaths worldwide, second only to India, who stands at 17%. In spite of Nigeria's strategic position in Africa, the country is greatly underserved in the healthcare sphere. Health facilities are inadequate, especially in rural areas. On this week's edition of the program, we take a look at the nation's health sector. Hello there. Thank you for joining me on the program this week. I'm Gloria Umezuke. The World Health Organization ranked Nigeria 187 out of 191 countries in its 2015 ranking of the world's best health systems. A poor rating, if you ask me. Well, the World Bank observed that Nigeria accounts for more than 900,000 women and children who die every year from largely preventable causes. Well, similarly, the nation accounts for 13% of all global deaths of children under the age of 5. Again, second only to India at 21%. So what is the government doing to change this narrative? On this, I spoke to the Minister of Health. Well, coming up next. The federal government, through the World Bank's Saving 1 Million Lives initiative, aims to increase utilization and quality of high-impact reproductive, child health and nutrition interventions by state governments. Each state and the Federal Capital Territory were given $1.5 million each to carry out the intervention within their jurisdiction. Listen to this. The Ministry of Health says 2,300 under 5 children die daily in Nigeria owing to preventable health challenges, including malnutrition. This can be related to the 43.3% of the nation's population that have access to healthcare facilities.
Just here in their capacity, but also some of
This is one statistics the federal government wants to turn around with the Saving 1 Million Lives initiative with funding from the World Bank. Under the initiative, each state and the Federal Capital Territory is given $1.5 million each to improve mother, child and newborn health.
We want to make sure that we improve on maternal and child health, as we've stated. We want to improve mother-to-child transmission of HIV. Nigeria is one of the major exporters of pediatric HIV. And what we are saying is that we have no business being a major producer of pediatric HIV. We want to make sure that every child in this country is immunized. We tackle malnutrition, treat malaria. We are committed to eliminating malaria-related mortality by 2020.
This program seeks to inject a new lease of life into the health system through collaboration with states, local governments, development partners, civil society organizations, and most importantly, through the communities.
The total sum of the credit facility from the World Bank is $500 million, and the initiative is expected to run until 2019. This initial disbursement places a demand on the states to ensure a proper utilization of the fund that will determine their participation in the next disbursement.
You are aware of the prevailing challenges concerning the welfare of our mothers and children. This therefore made it absolutely necessary to ensure proper utilization of the funds to be disbursed. I agree with the Honorable Minister of Health that the greatest asset Nigeria has is not oil, but the human resources that are abundant. You are aware the present administration was elected on the basis of change, accountability, and transparency. And therefore, I want to urge beneficiaries to ensure strict compliance with the principle of accountability, because there is no alternative to it in this situation.
On our part, as governors of the states, I am assuring the minister that we are going to collaborate fully with the Federal Ministry of Health in ensuring the success of this program.
The ministry says it's committed to developing and implementing policies and programs that will strengthen the national health system for effective, efficient, accessible, and affordable delivery of health services in Nigeria. Hopefully, this initiative can drive this vision.
And since we are saving lives,
The federal government plans to spend 3% of the total budget on the health sector. Well, this is a fall from 6% in the 2015 budget, thus raising questions about the government's plan for the health sector. Now, the Minister of Health, Professor Isaac Adewale, sheds more light on this. Now, listen to our conversation. Welcome to the program.
Thank you so much.
Well, let's begin now with the policy thrust of the federal government for the health sector.
Well, thank you so much. This country has had two previous policies, one in 1988, one in 2004. We are coming up with probably the most ambitious. We're growing. We're also committed to taking health to the doorstep of our people. We're also keeping in touch with the latest developments globally. That new policy is actually titled Health as an Instrument for National Development. That's the title of the new policy. And then we are focusing on a one-term agenda for health, and that is universal health coverage. And when we talk about universal health coverage, we imply offering qualitative, affordable health care to our people without necessarily turning them into poverty.
Okay, so now let's understand again the Rapid Result Initiative.
It is actually an initiative initially very restricted to the private sector, but now taken over by operatives in the health sector to deliver quickly results to people within a short and really limited time. And what we've done in this connection is to work in partnership with the Rapid Result Institute in US, and we set before ourselves some very ambitious goals within 100 days. We call them WOW goals, something that will make loud noise, that will really bring government closer to the people, and we show the Nigerian people that this government cares. And we've identified 7 sets of initiatives under the RRI. The first one is we want to deliver on a promise for the 110 primary care centers in 100 days. And our plan was actually to start counting about 2-3 months ago, but we had some delay, making sure everything is in place, securing resources, so we're starting today.
Did you say 110 primary health centers?
110 primary care centers in 100 days. That's like 1 per day. Actually, what we've decided to do is to pick 1 per senatorial district. So that will be 109 in 100 days. But in addition to that, in February this year, at the peak of the Lassa fever outbreak, I visited Fuka village in Niger State. Fika was the epicenter of the Lassa fever outbreak. We lost 17 people in Fuka village consecutively before the whole world and Nigeria got to know about this problem. When I went there to actually find out what went wrong, we discovered that what actually was missing was the primary care facility in Fuka. And the old one was locked up because it was bat infested. The new one was not completed, and the village head offered a room within his apartment. And we know full well that no one will go there. And so one after the other, people continue to die in Fuka until we stepped in. I made a promise that this government cares and will deliver the PHC in 3 months. And I can tell you today, the PHC in Fuka is ready for commissioning. So we will hand the one in Fuka to the 109 that we've selected across the country and deliver 110 functional PHCs in 3 months. We've identified them. We set up a team that mapped out the gap in terms of the human resources, in terms of commodity, in terms of the infrastructure, and we're ready to move in to intervene.